Jumping right in, the first argument to the AF case is that the Affordable Care Act greatly expanded access to insurance in the United States by expanding Medicaid and offering tax credits to buy insurance in the individual market. Those who are left without insurance probably just didn't want it. However, this is just not true. The Commonwealth Foundation found that even though the Affordable Care Act greatly expanded access to insurance, of the people who didn't enroll, 57% said that they still couldn't find a plan that they could afford. This is absurd. They also found that only 2% of people didn't know what coverage type they wanted, or they just refused. So when we look at this argument, we see that this is just not true according to the Commonwealth Foundation. These people wanted insurance, however, 57% of them couldn't afford it. Moving on to issue number 2, there is no solvency. Being uninsured is associated with worse health outcomes because it is associated with poverty. Living conditions, stress levels, access to nutritious food, and etc. wouldn't change for those folks, so their health would still be worse. However, again, this isn't true because according to the Center for Budget and Policy Priorities, Medicaid, Medicare, and federal tax credits, as well as cost-sharing reductions that enable eligible families to more easily access affordable healthcare coverage, is responsible for more than 8 million people being lifted out of poverty. So what we see with this is that people are being lifted out of poverty when they don't have to worry about health insurance because they can afford access to better schools, better food, less stressful lives. Again, because they don't have to worry about paying for health insurance, or they don't have to worry about paying out of pocket for a broken bone or an illness that their child is going to suffer. Moving on to issue number 3, there is no solvency. If they're right, millions more people would start going to the doctor, and then our system couldn't handle that many new patients. The wait times would be extremely long, making care still inaccessible. What we're going to do right now is listen to Dr. Christopher Haynes, a physician in Canada. He says that it depends on what you think you're waiting for. So if you're in a hospital and you need surgery, you don't wait. It gets done. If you need an MRI and it takes 30 minutes, then it's going to take 30 minutes. The wait times that people are talking about are about things that don't change, like hip surgeries and cataract surgeries. Those are non-cancer type surgeries, he says. They're things that don't get worse if you don't get treated. So you can wait months for those surgeries. It's not like people are going to be waiting for cancer treatments. Thank you.